Hello, my fellow dog professionals. Today I want to talk to you about brain health and how our brain is affected by menopause, why this happens and what we as midlife women can do about it. If you're having brain fog, memory loss, word finding difficulties, losing your train of thought, or difficulty in staying focused, so poor concentration, these may be cognitive symptoms of menopause. More women suffer from depression, low mood, anxiety, migraines, poor sleep, and even Alzheimer's disease and dementia than men. Out of every 3 Alzheimer's patients diagnosed, 2 will be women. It's a shame, but very little research has been done specifically on menopause and brain health. But here's what I found. So 2 of the main female hormones, estrogen and testosterone, yes, testosterone is a female hormone, plays a really important role in cognition and memory. So when levels of these hormones start to fall during perimenopause and menopause, some women have a rapid decline in brain function because the brain has less energy, and then some of us get symptoms like I did. So we have neurotransmitters, which are just chemicals that tell the brain what to do, and we have hormones that go into our bloodstream and then they go to the brain. Our neurotransmitters and hormones work together. Our hormone estrogen stimulates the brain, which keeps the neurons firing and supports the growth of new cells and helps the ones already there to form new connections. When estrogen falls at menopause, your brain as well as your body is suddenly deprived. Estradiol, which is a form of estrogen, is the master regulator and fuel, if you like, of women's brains. I mentioned earlier about testosterone, and that strengthens the nerves in the brain and helps you with mental sharpness and energy. It also strengthens arteries that flow blood to the brain, which is important to protect against memory loss. Adding testosterone to my HRT regime certainly worked for me. So what else can we do to help ourselves? In my book, Menopause and the Dog Professional, I cover lots on lifestyle changes that I have made for myself and really work for me and will work for you too. Better sleep boosts your mood and energy levels and helps with brain fog. Regular exercise can also help with brain fog, and I have found yoga and meditation to be a huge benefit to my overall well-being, both mentally and physically. Eating a nutritious diet with omega-3s, which can be found in eggs, fish, nuts and seeds, may also help. Make sure you have antioxidants in your diet, such as blueberries, raspberries, leafy greens, nuts and beans, and you'll be pleased to know dark chocolate. Be careful with that around dogs though, as I'm sure you know it contains theobromine, which is highly toxic to dogs. Of course, there's HRT, hormone replacement therapy. When our low levels of estradiol affect the levels of other hormones, so estradiol is low, we have lower dopamine and lower serotonin. So that will be why some women feel less joy and have less get up and go. My get up and go had definitely gone before I started HRT. Some women suffer from panic attacks and depression too. There's a doctor called Dr. Mosconi, an American brain expert, and she says there's evidence that the brain does keep producing estradiol at a lower rate even once the ovaries have stopped producing it, and some women function really well on those lower levels, but some women don't. We are all unique. Some women sail through the menopause transition and some women don't. I hope that's helped explain a little bit about your brain health. If you have any questions or you want to feel better and go from anxious to amazing, drop me a message or email me, Karen@menopauseandthedogpro.com, and book a 15-minute discovery call with me. Take care of yourselves and have a great day with your dogs.